So let me just tell you a little about the World Breastfeeding Week. It is a global campaign held annually from August 1st to August 7th. It is to promote and support breastfeeding as a vital aspect of infant and maternal health both. So it's actually the aim is to ensure to raise awareness about the importance of breastfeeding, highlight its benefits, and advocate for supporting policies and practices worldwide. So we all know, breast milk is nature's perfect food for the infant. It contains a balanced blend of proteins, fats, carbohydrates, vitamins, and minerals that are tailored to meet the unique nutritional requirement of your baby. I'm talking about exclusive breastfeeding. So it is like where you are not even introducing any liquid, juice, anything as such. So your initial 6 months has to be exclusively breast milk as much as possible, right? So it is considered to be a perfect nutrient for your child. Many mothers, what happens the moment they deliver, they see that the doses are very very tiny. They are like, they think the child is not getting enough. They think the milk secretion is taking time, so they try and switch to formula milk. But trust me, remember that those tiny doses are actually enough to ensure that your child is getting the proper nutrients, what it needs in that early stages. So it is definitely a nature's a perfect blend of nutrients what a child can get the moment they are born. It is easily digestible. It is like ready to serve. There is no like mixing and everything, looking at the water temperature and everything. So it is like ready, you can give it to your child. And moreover, not only that, it is just not a food for your baby, but it is also a kind of a magic liquid which is gonna ensure that your child can be protected from any kind of a health diseases and everything, right? So it has a lot of antibodies and everything, growth hormones and everything mixed with that, so which is absolutely a proper blend which can help them, right? So what else the breastfeeding does? So it helps to develop the bonding and the attachment between the mother and child. It prevents hypothermia, falling down of the temperatures and everything. The intelligent quotients, everything gonna increase. So we will discuss all this in a little in the next slides. Enhances brain and visual development. Adequate growth and development is seen in mothers who breastfeed their children. The advantages are like unlimited, so you can still see like how it is going to help to a mother. So what happens is the moment the mother delivers, it also helps them when they start breastfeeding. It helps the contraction of the uterus back to the normal shape and everything. So that helps in regularizing the bleeding, and it can prevent anemia, everything in the child. And it delays the next pregnancy. As we all know, the moment the mother is still breastfeeding the child, the oxytocin levels, everything is going to be different level. So the chances of conception is going to reduce during breastfeeding time. It protects mothers basically from breast and ovarian cancer, which is actually a big thing now, where every third to fourth ladies tend to show the symptoms of breast and ovarian cancers nowadays. So it is something which is going to provide a protections against that. And it also protects obesity in women, and especially also helps in maintaining the body shape also, because it is going to the maternal fat which is put on during your initial 9 months of pregnancy and everything, that will be used as a maternal storage during the lactation period. And it is also a convenient thing for mother and child both to feed the child as and when required, right? And also if you look at it, it helps them in managing the budget and everything. You're not spending on expensive formulas and everything, and your child is falling less sick compared to children who are fed on formula milk and everything. And it helps in improving the bonding. It's a magical feeling when a mother feeds a child, because this is something, a nutrition which a mother can give directly to her own child, right? So it is also eco-friendly, a very very a good thing, I would say, in a society way also. If you look at it, there's nothing like where you need to find anything special to breastfeed, just that you have to take care of your child. So if you look at the composition, breastfeeding milk has more of the good things that a baby needs. So if you look at the list of things where we have mentioned that breast milk and a formula milk is more of a supplement kind of a thing, a kind of a thing where it is like being tried to formulate near the breast milk as much as possible. So they have all the vitamins added, carbs added, proteins added, DHA, and all the arachidonic acid added, everything trying to mimic the breast milk. But breast milk comes with certain natural antibodies and hormones, antiviral capacity, antiparasitic capacity, the growth factors, enzymes which will improve the digestion of the child. Because see, the moment the baby is born, the digestive system is not 100% developed, so it's going to take time to have it. Moreover, what happens, the difference between formula milk, cow milk, and breast milk is that the cow milk forms a hard curd when it breaks down in the stomach, and it takes longer time for the baby to digest, and that can give a tummy pain to the baby and everything. Formula milk will have a little better curd compared to cow milk, but the best one is the better breast milk. Here you can see the very clearly the composition of the milk, of the animal milk and the human milk. If you look at it, we have tried comparing between cow milk, goat milk, and human milk. So if you look at the protein content, especially the one where we have all those bars and everything where we have mentioned, the protein content of the human milk is very low, whereas the lactose content is very high, and you can see the fat content is more or less similar. But the difference, but that is the actual blend what a infant needs when it is born. So the protein requirement is like the casein to whey protein ratio we calculate. So that is very, very high in cow milk, and then goat milk. So that much of protein is not needed for the baby when it is born. So the amount of protein which is contained, which is hardly 1.1 gram, that's how we calculate and everything when we study, or the protein content of human milk is very low, but that is enough. But the fat and all will have essential fatty acids and everything in the human milk, which is needed for the baby in the early days, and the lactose to provide that energy for the baby basically. So the water content will be high in the human milk and everything. It forms a softer curd. So the composition is very, very different. So definitely try if you can opt to the human milk than the cow and goat milk for initial 6 months. So if you look at the differences in the quality of proteins, right? So you will see that there is a whey protein, there is a casein protein, right? So cow milk has 80% of casein, whereas the human milk has only 35% of the casein, whereas the whey protein content is higher in human milk, which is very, very essential for to develop that anti-infective thing, to improve immunity and everything. So you will get more whey protein through the human milk for the baby, and which is very easy to digest, whereas the casein forms the hard curds, and it is very difficult for the babies to digest. So you will see that the stools are becoming a little harder in infants. They will find very difficult to pass stool. You can feel the pain on their face when they are passing stool and everything, whereas with the human milk you will not see that kind of a thing, and it is easily digestible for them. So the difference in the fats also you can see here, both of them have fat, but if you look at it, there are a little bigger fat molecules which we are trying to show, which has more of essential fatty acids, whereas essential fatty acids are actually absent in cow milk, and there are not even enzyme lipase. So enzyme lipase, what it does is it breaks down the fat. So in the human milk you already have that enzyme which can break down the fat, whereas in cow milk it is not there. So a body has to produce to digest that. So it takes time for the children to digest the milk and everything. So you will see a lot of gas formation in children because of this milk when you give apart from the human milk and everything. So it means there's a time where it is taking. While passing stool, there'll be a lot of gas release for the children, for the infant and everything. You will see with that. So definitely human milk has lipase and fatty acids, which makes it very easy to digest the fat as well. So if you ask me, like, till the mother, the baby is inside the womb and everything, mother will be getting a supplements of iron, calcium and everything. But once the baby is delivered, if you look at any milk composition, milk is very low in iron content. But if you look at the human milk, whatever iron content it has, but the absorption of that iron is very higher from the human milk compared to the cow milk. So if you look at it, it's just 10% which is absorbed compared to 50% iron which is absorbed from the human milk. Coming to the vitamin content of it, see, the moment the child is born, what all he needs, the essential vitamins are vitamin A and vitamin C and all, which is needed so that they can develop that immunity and everything. The eye, vision, everything can have clarity. So if you look at it, the darker one is the mother's milk. So vitamin A is high, vitamin C is high, though the vitamin B is low, but these are the essential vitamins which are high in human milk. So I hope breastfeeding mothers who know about breast milk and everything, I'm sure they know what is colostrum. Colostrum is basically the first milk which is formed during the pregnancy or the late onset of the pregnancy, or during the, once you deliver, the first milk is formed, and that is called as colostrum. It is also called as golden liquid, because it's a magic liquid, because it has all the essential antibodies which can protect the child from getting any kind of infections and everything. It may not be like in a big bottle kind of a thing that you get it, but it may be very few drops also, but that is considered to be a very, very significantly high in nutrients as well as antibodies. So it is called as like, golden liquid basically. So it is it basically comes out in the early few hours of your delivery and everything once you start breastfeeding your child. So it contains antibodies, which is going to prevent from infections and allergies in the children. It has many white cells, which is going to provide protection against the infections. Purgative effect is nothing but it works like a laxative tool. So what happens, the baby, once it's born, it has to pass on that black sticky stool, right, which is called as meconium. And that comes when you give the colostrum properly. And it also, once this meconium comes out properly, your child can also be prevented from the jaundice, which is most commonly seen in newborns. And it has growth factors and everything. So what happens, your gastrointestinal tract, everything will be at the maturity level. So when you get this colostrum and everything, it will help them to mature further. And it is definitely rich in beta carotene, and that is what it gives that color of like, little yellowish and everything. And it reduces the severity of any infection. So definitely try, ensure that this initial few hours, try if you can feed your child so that your child is getting that colostrum what it is supposed to get in the early few hours. So breastfeeding and cognitive development also, if you look at it, breastfed babies have 5 to 6 IQ points higher than the formula-fed babies and everything. Not only that, it also helps them like the visual maturation happens, the language development. We see a lot of delay development in some children, sometimes motor skills development and everything. So these all will, happens when you give a proper breast milk. Exclusively breastfeeding when it is done as much as possible, unless there is any kind of contradictions in a mother because they can't breastfeed 100% or something. But you should try initially 6 months if you can breastfeed your child as much as possible. So breastfeeding prevents early malnutrition also. So malnutrition can happen. So what happens is, malnutrition is not about just that your child is losing the weight or something. It can also be like your baby is becoming a big fat baby. So what happens, it happens when you start giving too much of formula milk and everything, those kind of things. So like, you're feeding full bottles and everything and your baby is growing, but the essential nutrients are being deprived of. So, the best thing to prevent malnutrition is to ensure that you're not delaying the breast milk, initiation. As early as possible, you should try to breastfeed your child. Provide you like, as much as possible, initial 6 months has to be breastfed. And then you can still continue breastfeeding for another 2 years if you want. And try as much as possible, like, your complementary feeds are everything started only after 6 months. So never be in a hurry to start early, because, your gut takes longer time to get matured and everything. And overfeeding, as I said, so that has to be taken care, so that your child just doesn't look chubby, but it is actually getting all the nutrients properly. So breastfeeding and low birth weight also, like, the children who are born with less body weight and everything. So when they are fed with the breast milk, they get all the higher concentration of proteins, essential fatty acids and sodium, which is actually needed for them. Because you will see that when the baby is born preterm or say low birth weight and everything, a different type of special formulas has to be given, which are completely pre-digested and everything, so that the digestion is not getting affected. So the best thing is to give breast milk again in low birth weight infants, ensuring that it is going to prevent hypoglycemia, because we see a lot of children having a low sugars after their birth. So breast milk provides them a good amount of lactose, which I've already shown you, so that can be taken care. Hypothermia, as I said, the temperature dropping in the kids. Some children will become, infants will become a little cold kind of a thing. So all those things can be taken care if you're breastfeeding your child. It protects from definitely from, any kind of infections and everything, all those things. And it actually, the child will picks up the growth and the weight, everything, body weight is picked up by 6 months and 9 months if they are breastfed initially. Properly, and it reduces any mortality also. This was all about the breastfeeding, like, just to tell you about what is colostrum and why it is important to feed the baby and everything. But now let's understand the dangers of artificial feeding and bottle feeding. What happens? We all as mothers feel like, it is very, very convenient to give a baby, add the scoop of formula with 30 ml of water, or 2 scoops of formula powders, and mix it with the 60 ml of water, however it is. And your child drinks good initially in first week itself. and you can see that your baby is able to finish also, and we feel very very satisfied also, like, baby is getting so much of milk. But that much is not required. What your child requires is a very very small doses of milk. So what happens when you, though we feel good, but it can also harm your baby. So what are the dangers of this artificial feeding? That's what we need to understand. Like, what happens is the diarrhea is seen more commonly in this kind of children. So they lose more water because of this thing. The stools can be very hard because of the artificial feeding and everything. And you need to prepare everything. Your bottles has to be sanitized. Your water has to be boiled and kept properly ready. Everything mixing has to be done, taken care. Leaving the formula and again feeding that back, they all can cause infection. So you have to be very very careful about it. Never be it takes time for the babies to get digested. Lacks the definitely the nutrient balance which we spoke initially. Like, there is no comparison between mother's milk and everything. So the infection, malnutrition is very high, their immunity can be low, so they all can impact the baby's growth and development and their health also in future. And since mothers are not breastfeeding, so their hormonal balance will be in a different way. So they can get, they can conceive a little early also if they are not breastfeeding their children and everything. So what happens with the mother? This is for the baby. So mothers, what happens, the mothers will not have that kind of a body attachment, skin to skin touch much happening with the child, since they are not breastfeeding their children, their infant. Allergies can happen because of this formula milk, and milk intolerance can happen. You will see a lot of lactose intolerance in children. Allergies because of the cow milk protein allergies, you will see. Increased risk of this chronic diseases. We see that, there's a lot of data which shows that, extensive research is showing that when if you're being breastfed in the late adulthood, the chances of metabolic diseases are low if you've been exclusively breastfed for initial 6 months and everything. So overweight babies can become overweight and everything because of this formula fed milk and everything. And definitely it impacts their intelligent quotient and everything. They can become they will have less calcium, iron stocks compared to other mothers who are breastfeeding and everything. So those things are definitely there. So I invite Dr. Harshita. So
Yes, definitely.
ladies and gentlemen, Dr. Harshita is actually a lactational consultant. She works very closely with the mothers. So she's gonna share some of her emotional and bonding benefits or experiences of breastfeeding for both mother and baby. So let me just ask you a few things. How does it feel to work like a lactation consultant, Dr. Harshita?
Well, first of all, having a look at the babies, the whole day stress is just weaned off. There's no stress at all.
Yes,
Just go look at the baby, just born babies, and it's amazing. Their smile, the reactions of them. It's really amazing to work with new moms, and the joy in the mom's face looking at their babies. That gives an another level satisfaction. Okay, doing something which we like. So
correct.
that way, stress management is easy for us. One way.
Yeah.
Okay, so that's how it our day starts and day ends. Mothers feel satisfied after we helping them out and latching the baby,
Wow.
helping them out and positioning. They feel very much satisfied, and that is also a satisfaction for us.
Many new mothers always worry about their milk supply. So, they
Yes,
always, the first question is the milk is not coming properly and everything.
yes.
So, as a lactation consultant, what are your, inputs on this? What could be the effective ways to ensure that the adequate milk is, produced and it is being supplied to the baby and everything? So, how are you going to counsel so that we also know, many things, many people, many mothers, they think that milk is insufficient.
Basically, what happens the moment we enter the room post delivery, the day
Uh-huh.
one, the
Mm-hmm.
first thing we hear is, ma'am, there's no milk. There's no
Correct.
milk coming out.
Correct.
Babies are very small. Okay.
Yeah.
They're just day one or day zero. The stomach of the baby, the size of the stomach, right, will be like around a cherry size, very small. Few drops of colostrum would do.
Okay. Okay.
So we can explain them in that way, telling that this is enough. And the way we express the milk, the way we show them where is the milk coming out, how do we check if the milk is coming out. And the moment we check, it's mechanical pressure mostly. The moment the baby is going to latch, the baby is close to mama, the mama feels so happy, and she starts releasing oxytocin.
Okay.
Oxytocin helps in releasing milk. So that way, the milk easily goes to the baby without any kind of pressure. Baby just has to suckle, the milk flows in and goes to the baby. There is a transfer of milk happening. And this way, we counsel them, we help them to understand that this is the physiology behind it. So please do not expect some 10 ml, 15 ml flow in day one.
How about some mothers, like, as you said, the first question is about no milk, my milk
Yes,
supply is less. The next
yes.
question is they experience a lot of discomfort or pain while breastfeeding for the first time and initial days.
Yes.
So, what
Yes.
could be the potential causes of this discomfort, and how do you think we can address this and manage it? If you can give some insights.
First of all, when the nipple is stimulated for the first time,
Huh.
that definitely there's going to be some discomfort. So for
Okay.
this reason, we can ask them to gentle massage with the coconut oil in the later stages of pregnancy, closer to the delivery. Usually, we do other classes like prenatal exercises and things. In that classes, we counsel them to reach us out at 34 weeks or 35 weeks, or at least by 37 weeks if they
Okay.
haven't delivered till then. So once they reach us out, we ask them to gentle massage over the nipple and the areola, both the regions, with the coconut oil once in a day. And immediately after delivery, we can do one more thing called as baby crawling.
Oh,
Okay,
okay.
the breast
What
crawl
is
we say.
that? Okay.
We just position the baby immediately after birth on the abdomen.
Oh, okay.
They recognize the breast. It's like rooting towards the food.
Food.
They smell, they smell the breast, they can feel the smell of it, they root themselves, they crawl, they reach the breast on themselves completely.
Wow.
Just we need to ensure the safety of the baby. Just be around, ensure the safety of the baby.
Okay.
And this is literally amazing to watch,
Okay.
amazing to enjoy.
Yeah.
It happens with some time. It takes at least 45 minutes to 1 hour of time for them to understand, reach, and have a latch on self latch.
Okay.
Okay, so
Okay.
they literally go, they search the breast, they root themselves. This may not cause any kind of pain to mama.
Yeah.
Okay, you were talking about the liquid gold, the colostrum.
Correct.
Yes, that will easily come out when the baby sucks out.
Oh, okay. That's
So
good.
when we do it, we take the baby, we help them in positioning the baby, hold the breast, put it inside the mouth, that we are giving some kind of pressure over the nipple area.
Absolutely.
That is one of the discomfort being caused to mothers.
Okay.
So rather we can help them self latch or being gentle with them. And
Okay.
one more is proper positioning of the baby. If the baby is not positioned properly, though you give a good latch, the baby is going to end up with a bad latch, and that definitely causes some pain. Later stages, it bleeds, and again, so much of hangama, infection, and everything happens.
Correct.
So, to correct all those, perfect latch, educate them about the perfect latch, everything sets up.
How early you think a child has to be put to the mother's breast? Latching mechanism,
Yes,
starting, all that.
within 1 hour, if it is being
Okay.
stimulated or initiated, that's an amazing thing to be done, which we say is golden hour.
Golden hour, right? Yes.
Yes,
Yes.
the golden hour of the breastfeeding is the first 1 hour of after birth.
Unfortunately, what happens is we see a lot of LSCS happening,
Yes,
cesarean
yes,
sections, and mothers are like
yes,
completely unconscious. So you think
yes.
that gonna impact their colostrum and everything?
There's no impact on the colostrum
Colostrum.
or any
Okay.
kind of milk supply over the like because of the LSCS or any kind of anesthesia. There's no impact over that, but there's stress. They'll
Okay.
have stress. This stress is an important factor where the milk production is being stuck up. Okay,
Okay.
the release of milk stucks up because of the stress.
Okay.
Oxytocin and the stress hormone are like completely opposite. When there is a stress, the oxytocin reduces.
Okay. Okay.
Stress hormone goes up.
Many mothers have asked us this question, like, what should be the frequency of breastfeeding?
Yes.
Does it need to be a demand breastfeed, or it has to be like every 1 hour I have to ensure that, I have to put, and again, the entire thing, like, should I put it to one breast or should I put it to both the breasts at one go? How it should be, if you can just shed some light on that.
So basically, what we advise is every 2 hours once. It's a
Yes.
universal thing. Every
Yeah.
2 hours once, a baby has to be fed.
Correct.
But every baby, every mother is different.
Mm-hmm.
Okay, some babies sometimes they might take a longer feed in one feed,
Okay.
and the next feed would be very shorter,
Okay.
and the next progressing feed would be again very shorter. So it depends on the babies.
Uh,
Okay, and I would suggest one side of the breast for one meal. It's like one meal for the
okay.
baby. The reason being there are two types of milk in the breast. The mature milk.
Huh.
Okay, one is the mature milk, one is the colostrum.
Correct.
In between, there is a transition milk. So
Absolutely.
transition milk is just for a day or two, and
Yes.
this colostrum is for 3 days almost.
Okay. Okay.
And the mature milk is throughout. After that, it's always the mature milk. Again, this mature milk is of two types again: fore milk and the hind milk.
Milk. Yes.
Fore milk is maximum water, and the hind milk is completely nutrition.
Okay.
The DHA, antibodies, the
Yeah.
hormones, whichever is required for the baby, is in the hind milk, and the fore milk is containing only water. This water comes out, the fore milk comes out on in the initial stages of breastfeeding,
Mhm.
whenever the mother is feeding at whatever time it is.
Okay.
So
Okay.
first comes as the fore milk, then flows the hind milk. As you were discussing that we are not supposed to give any other milk or water to the baby for initial 6 months. This is the reason water is positioned in the breast milk already, so
Yes.
baby gets water also, and then the nutrition.
Yes.
So it's for 5 to 10 minutes initially. The water milk comes out, and then the hind milk comes out.
Okay.
So
Okay.
for that reason, if we feed 10 minutes on one breast, 10 minutes on one breast, we give only water milk to the babies. We never give nutritious food to the baby.
Okay.
So
Okay.
it can be 20 to 25 minutes one breast, complete feeding, burp the baby. Again, if the baby requires, then shift to the next breast.
Next. What happens, the mother, I mean, it's not for the early days, but once the you can say the mature milk has started and everything, you feed from one side, the other side you find a leakage and everything happening.
Yes, yes,
So what happens, mothers will shift the baby to this side so that the milk
I
can be like
understand.
balanced and everything. That's one thing. And one more question is the hygiene of the nipples and everything, how to.
Yes. When this is an common thing, okay, it's an hormonal thing. Okay, let down response, we say.
Yes.
When one side they're feeding, the other side starts leaking, there's a
Leaking.
let down response. That's okay. No need to shift in that particular time. It's okay. It can leak, or it can be collected in a container, sterile container, and can be given to the baby later with a palada or any kind of cups, nifty
Okay.
cup or something is available. With that, they can feed the baby, not with a bottle.
Okay. Got
Okay,
it. Got
so
it.
this way we can do that, or they can use this reusable breast pads, or any soakable breast pads can be used to prevent that leaking. It will be there for only 3 to 5 days, or max to max 10 to 15 days.
Okay.
Post that, there won't be any leaking, because the brain will understand the need of the breast, need of the baby, and accordingly it will produce.
Got it.
Okay,
Yes.
coming to hygiene of the nipple, uh, every time we feed, there's no need it has to be wiped. Reason being, there are some glands on the areola which produces a particular oil for the lubrication of the lips.
Correct. Yes.
Okay, if not, the baby will end up having some kind of pimples on the lips. If they feel it's too sweaty, the body is very sweaty, just take a cloth,
Okay.
uh, cotton cloth, wet it up, and damp over the nipple, just like this. No
Okay.
need to wipe.
No need to wipe and
Yes,
everything, right?
that's it. And no soap application often.
Often.
The
Okay.
smell of the areola and the nipple may change, and the baby gets confused.
Many mothers, their
Yes.
maternity leave comes and everything, and they need to return to their work, everything.
Yeah.
They have that urge, like, I need to continue breastfeeding.
Yes.
So,
Yes.
as a lactation expert, what are your things? There's strategies they need to, adapt so that they can still continue successful breastfeeding because.
We ask mothers, say for example, in another 15 days they're going to start their work. So 15 days prior to the work, they can start pumping the milk.
Okay, 15 days prior.
Okay,
Okay.
yes, 15 days prior, so that the production improves.
Okay.
Okay, their need is the requirement of the baby would be met around 15 days.
Okay.
Because they have to step out of the house, they have to store the milk,
Yes.
okay, in the refrigerator, or like I'll be explaining that also. So what happens, you can start they can start pumping the milk in like around 10 days prior or 8 days prior, and start storing it in small packets or small bottles.
Okay.
Say
And
for example, baby requires 80 ml per feed, so
okay.
only 80 ml in one bottle. So once
Okay.
removed, can't be reused again, rethawing, reusing.
Okay.
That cannot be a good thing.
Okay.
Okay, so can immediately after pumping to the freezer.
Okay. Got it. It has to be
Okay,
freezed.
yes, within 1 hour.
Okay.
It
Within
has to be put in the freezer. While removing, it has to be kept to the freezer to the fridge to the room
room
temperature.
temperature. Okay.
Like I have heard quite contradicting facts about whether a mother should or should not pump, right? So like what's your view on that? Like um, does that harm the milk production or the, I don't know, the bonding between the mother and child in any way?
A very good question. See, basically, pumping is not going to harm anything. Pumping is rather going to keep up the milk production, baby's requirements, because mother might not be present at the home during the daytime. She's being in the office, or she's out of the house. So at that time, baby needs milk. For this reason, we pump, we store, and we go. I would not recommend pumping when she's exclusively breastfeeding,
Okay.
so that the bonding is maintained. Baby is very well attached to the mother.
Okay.
Okay, that will not destroy the bond, but rather I would say not pumping when the baby is actually nicely feeding on mother.
Mother.
There's no requirement of pumping. Only if there is requirement that she has to step out of the house, there's no other option, I would recommend pumping.
I have one more
Yes,
question
please.
though. So
Yes,
I
please.
might have missed this while you were talking about pumping. So want to know like I mean how long can the pumped milk be kept in the
Yeah.
freezer and
Yeah,
then
yeah,
used?
yeah. Yeah, coming to that point. See, pumped milk can be kept in the room temperature for about 4 to 5 hours in the room temperature. Okay, and in the fridge for
Mhm.
about 15 hours
Okay.
to a day, 1 day, and in the freezer up to 6 months.
6 months. Right.
Yes,
Okay.
the foreign countries, they use these frozen milk to make cookies and things even after they stop breastfeeding.
Correct. Correct. Heard about it.
Okay, so we can do it that way also. We can use that milk in if the baby is not breastfeeding anymore, or baby is not having the milk in any other forms, can be used in any other cookies or anything, and we can feed the babies.
Breastfeeding is exclusively a mother's responsibility.
Yes, yes.
Do you think a partner, as a partner, spouses and family members, how they can help, like, support these mothers so that they can ensure the breastfeeding is actually taken care effectively and everything?
Not only father, the family members also.
Okay.
Okay, so first thing is to motivate her, motivate mother.
Okay.
What happens in the family is maximum of the times, the moment the baby cries, you haven't fed the baby, please feed the baby. The moment the baby is not like the baby is crying, the baby is uncomfortable, they give it to mama. You
Yes.
carry on, you
Yes.
handle.
True.
Okay, so that is not the thing where the family members can make it a different role. Doing that can be like, okay, baby might be crying for a different reason. I know she's been feeding for a long time. These simpler words affect a lot. She might think, okay, my family stands beside me, I'm doing the right things. Post delivery, mothers become very sensitive,
Absolutely.
very sensitive. A small word hurts them. Okay, the moment they are hurt, the milk production drops.
Oh,
Affected is the baby. Little bit of stress also, it is going to impact on the milk production. Fathers can take up, like, maybe she's tired. She's tired feeding. That time, what can be done? Pump and give. Let me feed it with the palada.
okay.
That can take up that responsibility.
True.
Okay, so mom, There's no one else going to breastfeed the baby. It's mother.
Absolutely.
So what can dad do? Diaper changing. Rest other works. Diaper changing the baby, babies burping the baby, then next giving bath to the baby. Mom, other family members would give bath to the baby, and then taking care of that baby, putting the baby to a nap, giving mama some rest.
True. I think
All this can be done, taken care of the family. Family has a bigger role in the breastfeeding journey of mom.
I had just one question, doctor. So
Yes,
we
please.
have, I've just gone through certain, reels and all where they show that if the baby has some skin issues, they add the breast milk to the water and they give a bath to the baby because they say breast milk has a lot of, good enzymes and everything. So I
Yes,
wanted to
yes.
know if that is that helpful actually, or it's just, a fad kind of a thing that people are just doing it. I just wanted to know that.
See, actually, breast milk is used in that way. It is used as a cosmetic purpose also. Okay, because it has that amount of nutrients, that amount of things and all in it. So yes, definitely that can be done, but I may not prefer it for the baby.
Mhm.
Yes. Okay. It has definitely, it has lots of healing capacities. Okay. The breast milk has containing, it contains a lots of healing like properties in it. Definitely it can be used in that way, but I would say, why to squeeze it and waste it? It's a lot of energy to mother to produce 1 ml of breast milk also. So I would not like to waste breast milk on certain things. So this is my insight of it.
Got it, doctor. Thank you.
You're welcome.
I think it was really, really informative so far. So I have one last question to ask. Worry about breastfeeding in public areas due to
Yes,
social stigmas
I
and
know.
everything. So, what do you advise as a lactation expert? And what mothers have to take care of it when they are stepping out of the home? Because many mothers, they don't step out only with the fear that they have to breastfeed their child
Yes,
and everything.
yes. So what I would suggest to all my like the moms who I meet in the hospital, I would tell them, carry an apron. Okay,
Okay.
breastfeeding apron, and it's the mom's right to feed her baby wherever the baby is hungry. Okay, nowadays many cafes, many shopping malls, many centers have come up with a breastfeeding room.
Child
Okay,
care.
and an infant room for any mall you step in, any cafe you go, there is a breastfeeding room available. In any of the bus stops, any of the biggest bus stands, or anywhere you go, it is there, and it's our right to feed the baby wherever the baby is hungry. Okay, so
Mhm.
we can stand against it and we can go ahead and we can deal with it. If not, if it's a difficult situation, we can use the feeding aprons available. There are feeding shawls available, there are feeding aprons available. We can go ahead, we can use those and feed in public. There's no issue, and it's our right to do it. I
Correct.
would not stop any mother doing it.
Thank you, Dr. Harshita, for sharing
Thank you so much.
so much
Thank you. It's my
invaluable
pleasure.
insights on this importance of breastfeeding. So, I think, guys, it is very clear that breastfeeding offers a multitude of benefits, not only
True,
nutritionally,
true.
but also emotionally and
Emotionally,
developmentally.
yes.
Right. So for those who are seeking further support on lactation and everything, Dr. Harshita is available with us for one-on-one consultations to
Definitely.
provide you with personalized assistance on the breastfeeding journey. So as she said, it can be even prenatal, where you can go for the counseling and session and everything. Understand, never get stressed that there is no milk and everything, because that itself is going to reduce the milk production and everything. So remember this, every breastfeeding journey is unique, and seeking guidance when needed can make a significant difference. So happy breastfeeding, that's what I would say, mothers who are expecting and everything.